If you're going to private pay for a nursing home, it's like average, probably closer to $9,500 per month nationwide.
Wow.
Now, personal care homes and assisted living facilities, the national average is more towards the $5,500 a month. Then you kind of go, well, if I'm going to go a private pay option, I'm very low too, because most of the nice places are $6,000 a month, or maybe $2,000 a month for a place you wouldn't want to put your pet.
Today I'm talking with Dr. M. Craig Moffett, a physician, advocate, and real estate investor dedicated to improving healthcare access in rural communities. From leading in hospitals and nursing homes to developing affordable care facilities, he's transforming lives. How does one man juggle medicine, advocacy, and real estate to create a lasting impact? I don't know. Let's find out. Welcome to the show, Dr. Moffett.
Glad to be here. Thank you, sir.
Hey, did you like that intro? You had a nice little smile there.
It made me sound very good. I'm good with it. I don't know if that's accurate, but I like it.
There you go. I aim to please. I do a little research and write up something clever. So there we are. So I mentioned right there at the very beginning, you grew up in a rural community, rural underserved community. I did as well. I grew up in a town in Western Iowa, about 1,500 people. Everyone knows everyone. You know every single kid in the entire school plus their grandparents' names. So yep. I got to imagine you're about in the same spot. But what personal experiences inspired your mission, one, to become a doctor, but two, then to improve access to quality healthcare in small communities?
So I had a lot of medical issues as a child. I had to have several surgeries before the age of 6, primarily mouth related, which is why I kind of sound a little bit odd for a Mississippi person. I definitely still have a Southern accent, but not your typical Mississippi accent.
Okay.
And we obviously, I think the closest pediatrician was about 47 miles away. Obviously, the closest hospital was like an hour away. The closest children's hospital was multiple hours away, where I had to go and have some of my stuff done. So from early childhood, I kind of understood that it was. I actually thought that how it was for everybody, but as I got older, I realized, some people just have access to doctors. Whereas it was a whole day. I mean, it was a whole day of school for me to go to one doctor's appointment because it took so long to get there. Even dentists. I mean, everything was further away. So that definitely kind of was some early on experiences that I had there personally that kind of led to me wanting to ultimately increase access in underserved areas. And I love Mississippi. I did consider leaving Mississippi kind of throughout high school and early college. Not that I had a bad experience, but kind of the whole I want more. I don't want to have to live in the same place again. But kind of early throughout college, I kind of that view changed to where no, I do love this, and I want to be able to maybe expand education and healthcare and stuff to others who maybe grew up in a similar environment to me. I mean, I had the biggest privilege of all because I had 2 loving parents, but I'm the first person to go to university in my entire family, first college graduate. My parents were working class, lower income, little means. So I think that's kind of what set the picture of what I wanted to do later on in life, if that makes sense. So.
Yeah. Well, no, I certainly have admiration for that because I was the same way. Grew up in a small town and we were right between Des Moines, Iowa, and Omaha, Nebraska is where I grew up. It was about equal distance. And so it was as you go off to college, you're going to some bigger university, and then usually you end up back in Des Moines, or you go to Omaha, or you go to Chicago. That's just kind of what everyone did. And so to actually come back and say, hey, I'm gonna plant roots and I'm gonna make a difference in the small areas versus, I mean, if you're in North Alabama, you could probably go up to Tennessee, you could go over to Georgia. I mean, you have options. You have big cities around you that you could have gone to. So to stick around in the rural space, I think is really cool. Has that been well received? As you've kind of planted roots and started making an impact in those communities, has it been well received, or is everyone dude, just get out of here and go to a big city?
No, absolutely. It's been well received. I had one doctor tell me one time when I was in med school, he's like, hey man, being a doctor in a small town is like being a rock star. And it is for the good and better. I mean, everyone kind of knows you. I remember I've been here a short amount of time, and I had a patient who was making wooden structures. And I was like, yeah, I'll buy one from you. And I was like, how do you want me to get to? He's like, oh, I'll just drop it at your house. I'm like, well, how do you know where I live? He's like, yeah, everybody knows where you live. And I was like, oh, okay. So, I'll walk into Piggly Wiggly and people will be like, oh, Dr. Moffett, skip ahead of me. I know you got to get back to clinic. I mean, they just like, let me jump ahead of them in line. It's been very, very well received. And I think it was also well received also because I'm from a small town. Now, I went to a slightly different small town than I grew up in, probably about an hour away from where I grew up at. But it's a similar vibe. My wife's in Jackson, Mississippi, which is the state capital, in the largest city in Mississippi. But she moved here with me, obviously, and we're raising our children here. But no, I think it's been very well received, and I've enjoyed it. And I'm close to a university. I'm only about 25 minutes away from the university, so if I really want to go do something, we could go there. So.
Yeah. Have you had any involvement with the university? I was going to ask you that, just knowing that you're in northern Mississippi, if Ole Miss has called you at all.
No, I went to Ole Miss. I actually live next to Mississippi State, which is their rival.
Oh, okay. Yep, that's right.
So most of my patients are kind of state fans, so I have to hide the Ole Miss a little bit. But no, I'm very proud to be an Ole Miss graduate. I do. I worked unofficially with both some because I live close to Mississippi State University. Most of my contacts have been there. Nothing in an official capacity for the actual university. Now, for the some of the towns around the area, I've definitely served in some various advisory roles or committees for some of the little surrounding areas, but not the university itself. So,
yeah, for sure. Well, I know when we talked offline, one thing that really caught my attention was the real estate. Obviously, that's something that we do on our Grand Vision side of things, and so I know enough to be dangerous, as they say about real estate. But in your space, I think it's really cool. So you hold some directorship roles, within long-term care facilities and what I would call nursing home type atmospheres, but it's just very expensive, right? I mean, the average cost in Iowa, I know, is like $6,000 a month or $6,500 a month to go to a pretty decent one. Obviously, then if you are on Medicare, they kind of send you to the lower end. What I think is cool about you is you're taking your passion for real estate and your interest for real estate and trying to integrate that with the medicine and the work that you do. And so, like, I guess thinking about that, what inspired you to combine your healthcare knowledge with real estate development and figuring out if this is something that could be beneficial to folks?
Well, because I love real estate. I've been doing real estate ever since I was in residency. I flipped a house my second year of residency. I've been doing real estate ever since then. I truly enjoy it. Obviously, I love medicine too. But I've even had days where I was like, well, should I look at cutting back in medicine and do more real estate, or should I do this, or should I do that? Not that I don't love medicine and enjoy serving my patients, but I've been struggling with that. And a couple of years ago, I was listening to podcasts like I always do, and I heard one about an assisted living facility creator. It was kind of one of the prominent ones. Her father wrote Silver Tsunami Residential Living Academy, I think is one of theirs. Big organizations, great people. And I was like, wow, she wasn't in healthcare, but I am. I was like, there may be a way that I could kind of do a little bit of both. And I do a lot of nursing home work. I'm a medical director at 3 nursing homes, and so nursing homes are federally funded primarily through CMS or state funded through Medicaid. So nursing homes receive their funding primarily through patients' Medicare or Medicaid insurance. Typically, if you're on the long-term care side, it's Medicaid. If you're on the rehabilitation side, it's Medicare. If you want a private pay for a nursing home, it's like average, probably closer to $9,500 per month nationwide. Wow. Now, personal care homes and assisted living facilities, the national average is more towards the $5,500 a month, but those are different things. So personal care homes, assisted living are typically more private pay, whereas long-term care nursing homes are more CMS funded. They're also more regulated. So I was seeing this huge gap in people who didn't have Medicaid, so they couldn't get a long-term room in a nursing home, but paying $9,000 a month is absolutely beyond their ability. So then you kind of go, well, if I'm going to go a private pay option, I'm very low too, because most of the nice places are $6,000 a month for a private pay option, or maybe $2,000 a month for a place you wouldn't want to put your pet. So and I understand that not everyone is going to be able to afford. I mean, like the one I have, when we get into it, but it's more, around an average of $3,100, $3,000 a month. But my goal was to get to where people who grew up maybe who lived as a teacher and had a pension from the state, for $3,500 a month, they might can afford to go live there. So I kind of wanted something that was going to be nice, but also affordable. Started looking at a lot of these facilities. I wanted to be personal care, which is not regulated by CMS or Medicaid. So I didn't have to kind of jump through those hoops, which are great facilities, nothing against it. I did not want to personally see patients there because I wanted to keep it separate, but I wanted to use my knowledge of the area and of the medicine to choose good doctors, nurse practitioners, nurses, home health providers, hospice companies. So I kind of wanted to be more in a visionary role there, but not actually see patients myself. Got some investors together, so all companies, doctors in real estate, doctors in care homes. I'm a 50% owner in that company, and I'm the president and CEO of it. We have one facility so far. It's a 19-bed facility. Like I said, we're around that $3,000 a month price range. Mississippi average is $4,500, so we're actually below the Mississippi average. But I feel that we're providing a above average facility, and obviously still hoping to turn a profit there as well. Yeah, I mean, my goal is how do I serve people similar to how I grew up, but still make money because I enjoy real estate because I think it's a good way to set up generational wealth for my family, but do so in a way that is also helping people because it's hard to find that. It's like, well, you're either making money or you're helping someone. I do think that there are ways to turn a profit and also produce a product or a house or a situation that is good for people as well, which was my desire. So,
yeah, without cutting corners
yes.
or anything like that, where it's very obvious, like, oh, this facility doesn't provide this, and that's because it's a major cost. So now that could be a deterrent for some people to not come. So what challenges have you faced that in creating facilities that are you're trying to balance quality care with affordability? What challenges have you run into?
And so far our strategy is actually to purchase already operational ones. One is for licensing because you have to get licensed for these beds. It's a little bit easier. So we haven't from the ground up built. So what we've had to look at is when we're looking at a facility, we're looking at what kind of bones are there, what kind of staff is present, what kind of automation is there that we can improve upon. Staffing is going to be number one cost and your number one issue. That's kind of nationwide. Nursing homes and assisted living facilities have very high staff turnover. So how do I reduce staff turnover? It's going to lead to better patient care because they're going to know the patients better. And it's going to lead to reduced costs because it's probably going to be cheaper to increase someone's salary than to recruit a new one. I feel like most organizations are always they never increase anyone's salary, but they want to hire a new one. So as soon as I took over, met with everyone, I pretty much raised almost everyone's pay. There was some like how you need to stay for so long to get it or whatever. But I was like, I understand what you did was hard. I was a nurse aide before I went to med school, so I've done that job before. So I understand how difficult and underpaid it is. So the issues we encounter is how do we get a good workforce? How do we keep them? How do we get people who are going to take care of our residents? That's the number one issue. And then other costs are kind of food. And insurance. So, we got with several brokers. We reduced our insurance costs by about 25% to what the previous owner was with an equivalent policy. We kept food costs about the same, but increased quality of food by looking at several vendors. Met with a lot of different national, regional vendors for food choices. Keeping a good manager in place. We've kept the existing managers in place and empowered them to have the tools they need to be able to hire the staff they need. But pretty much it's going to be controlling costs, which is going to be your staff and your food for the most part. Insurance is another huge one. And so that's kind of what we've been working for there. No, it's not without challenges. Like I said, the insurance costs these days are crazy. We've done well with keeping our staff, but we have had to let a couple go. Very soon after getting a facility. I mean, within 2 weeks of getting a facility, we had someone who wasn't showing up at all. These are things that it's figuring out that staffing issue is the main thing. So,
yeah, it sounds very similar. So we do commercial properties. So we do like multifamily apartment complexes, and so very similar thing. Like the insurance is huge. That's always a big cost. We don't really have a lot of staffing, but like HVAC is huge. All the depreciating items that you want to have on there. It's like all of a sudden a roof goes out, and then you have a $12,000 water damage from a hot water heater in 2 units. And it's like you have all those costs that add up, and so it's like if you can mitigate those, I think that makes a ton of sense. And so operating your business, I think just being a business owner and having staff in the past, I definitely understand. Like it's a lot cheaper to just give someone a raise than it is to lose someone and then retrain the gap there. I
Yeah.
don't think people really realize. And so kudos to you for going in and finding existing property, because that's what we do as well. And then just finding what are the efficiencies, where can we get more efficient, run a little bit leaner on these, but not give up the quality of care, and give up the affordability that we want to have. So I think that's really cool. So knowing all that, like, how do you juggle all that? I think that's my biggest question is, like, you're, a clinic physician, you said you're a director at 3 different places. You're doing the nursing home thing, as a business owner. I know you also have, like a training center, like a sports training center. You have a business owner in that space. So it's like, you wear all these hats. Like, how do you manage these diverse roles, in an efficient way?
Well, the first answer is I'm not sure that I'm maximally efficiently doing it at the moment. It's a process.
Yeah.
I'm 35. I've been in a team lead position for 5 years. I've been a business owner for a couple of years. Well, I guess if you count my real estate, 6 years. But I don't think I'm at maximal efficiency yet. I don't know if you ever get there, but I think that I've got a long way to go. But really, it comes down to your team, which for me, the most important thing is a spouse. I mean, I also have 4 children, and obviously I want to, while I am trying to build some generational stuff for them and help them, I also don't want to miss their entire lives either. So I think that having my home environment managed well by my project manager of a wife, who helps keep me managed as well, is the number one thing. And she also helps with some of the business aspects too. I just delegate when I can. So I mean, when I was looking for partners, I knew that one thing I didn't want to do was spreadsheets. I don't know what it is, but I hate spreadsheets. I hate tracking that stuff. I love big picture numbers, but I hate small ones. So one of the partners I got is actually an accountant, and I made him a CFO, and we pay him a small salary, and he handles all of that. So I don't have to do any of that. And then my personal accountant helps with some of my smaller businesses. So I pay her assistant to do some of my QuickBooks for the smaller stuff.
Sure.
For the gym, it's mostly automated. Honestly, it's kind of almost like a call center. We don't really make a whole lot of money there for the sports center, but it's something I enjoy. But it's pretty much just 24-hour access. You sign up online, you pay online, you get mobile access to it. So I mean, there's not really much I do there. But it's a lot of organization. It comes down to, I mean, you need to have, my day is fairly regimented, but I also have to be able to kind of do things on the fly. I do hospital as well. So I go to the hospital first thing in the morning, then I take my kid to school, then I do clinic. I'm taking business calls kind of throughout the day. So I think that I've got a lot to learn there. I do try to have some protected family time, some protected business time. It does commingle some at this point, but for me, thus far, it has been trying to follow a daily schedule, write down my most important tasks, mark them off, have my good team, my wife, my accountants, my CFOs, my gym managers, my kind of having that correct team, and I'm trying to stay, which is where I'm good at, in a very high level kind of CEO type role. Because I would not be the best COO. I'm not the best at the daily operational thing, and I realize that. So I try to get people who can do that. So.
Yeah, no, delegation is the perfect answer. When you have all these different things moving, I was just trying to picture as you were talking, like your calendar, if it's like color coded with all the different roles and hats that you wear. It's like, all right, from 10 to noon, I'm doing this. And then from 11 to 3, it's something different. It's just all the different colors on your calendar is what I was picturing. I think that's the best way to do it. How do you keep yourself, I guess, sane? I know that you said, like you have dedicated family time. I mean, we're talking on a Wednesday, and that maybe is some free time for you. How do you break it up to say, okay, for me to not just get burnt out from all the things that I'm doing, how do you make dedicated time for that?
Still struggling with that as well. So I love my primary, I love clinic. I don't want to quit it, but I've got some plans in place. I'm trying to cut back certain aspects so that I can kind of, what I'm trying to ultimately do is get physician work that I'm able to kind of do more on my time. That's why I like the nursing homes. So the nursing homes, I pretty much tell them when I'm coming. I mean, they call me. I'm like, hey, I'm coming this day at this time. And then a lot of the medical director stuff is high level stuff. It's like over 3 months, analyze this antibiotic pattern and utilization pattern and see if you can come up with an idea of how to decrease antibiotic usage and just do it whenever you want to over the next 3 months. I like those roles because I'm a hard worker. I don't mind working at 6 o'clock on a Saturday morning or whatever it is. So I'm trying to get jobs that I control my time. So I'm trying to work towards that. I'm not fully there yet, and I don't want to give up clinic completely, but I'm trying to move more towards roles where I control my time, so I'm able to more aptly do this. But in the short term, kind of, how I do it right now is, trying to have the protected things that are important to me. Exercise and physical fitness is very important to me. I may only get 20 minutes a day done. I may do 200 push-ups in my office, but I make sure to do that, do some type of physical event every day. I try to make sure to have some family time every day. And then, I went through a lot of different calendar methods, but honestly, what works best for me is every night before I go to bed, I write down my main objectives for the next day that have to be done. And then I look over that in the morning, at lunchtime, and at nighttime. And then once a month I do monthly, quarterly, and yearly planning. So I kind of once a month I'll go back over, okay, what was my big objectives for this month, for this quarter, and for this year, and I do that once a month. So it's a work in progress. It's not I don't have the super colorful calendar that I can't tell you, use this calendar app and it gets your life completely organized. I mean, I don't have the perfect answer there, but
Are you a pen and paper guy then?
Yes, so I have I'm a millennial, but I have a leather-bound notebook that I keep with me with a pen, and I write down important information, my main daily goals, my yearly goals, my 5-year goals, and everything. I write down in this leather-bound notebook. So, I like that. So,
no, that works. We're about the same age, so it's different to meet someone who's like, hey, I'm a pen and paper. Like usually now at this point in our lives, we've been around since the beginning of the iPhone. And so, Apple Notes kind of controls my life a little bit. I'm definitely a checklist guy. I'll just, here's 10 things that need to get done today. And then I have that like internal satisfaction. Like every time you check something off the list and it like automatically slides to the bottom and always leaves the unchecked items near the top. It's like, there's something satisfying about watching that slide down. So, I really like that. I do have the calendar and I'm always looking at it. The goal thing I think is really good. I think that has gotten away from a lot of people of like setting quarterly goals, annual goals. I mean, you mentioned a 5-year goal is even something that if you're always looking at it, you're always thinking about it. It's almost impossible not to hit it, right? Like if your mindset and your mind frame is just always looking at those goals and understanding here's each and every day, here's what I'm working towards. That's pretty cool. So let me ask you that. If we're talking about goals, you said you're 5 years into attending. If you're looking at your 5-year goals from right when you got out of residency, day one, you're attending. And if you wrote 5-year goals, where you are today, were some of those 5-year goals, have they been accomplished?
Well, I was about to, next to me, I have all my notebooks in the years prior. I was going to pull it up because I did look at, it's been about a month since I looked at my yearly ones, but so of my 3 to 5 year goals, I actually had accomplished most of them. I wanted to bear property, which is basically where you buy, rehab, rent it, refinance it. You leave no money in the deal. So I did that. I wanted to get on the board of State Medical Association. I got elected to that 2 months ago. I wanted to create a business, an operating business. I did that about 3 or 4 months ago. I wanted to do more, get some additional nursing home work, which I did. My goal of cutting back clinic a little bit has not been completely met. And then there were 1 or 2 others. So I pretty much had 10 primary goals on there, and I think I've met 7 of those.
That's pretty good.
So
one thing that I learned about you as I was doing some research. So you have involvement with Webster County Sheriff's Special Response Team. Are you still doing that?
Yeah, but actually I'm missing it today, partly because of podcasting, and partly because I have some other things going on. They're doing a land navigation training today. But no, when I got here, I contacted the sheriff, the superintendent, the principals. Everyone is trying to meet everybody, and the sheriff and chief deputy at the time wanted to develop a program to kind of get some, honestly, sadly to say, like active shooter, at the school type stuff done. So we raised some money. We delivered trauma bleeding packs to every single teacher in the county. I gave training on how to apply tourniquets. We started training where every Wednesday we do tactical training where the county will have EMS there sometimes. We'll have fire department there sometimes, sheriff department. Me and the sheriff department are usually always there. We'll do medical training. We'll do tactical training. I kind of got like deputized.
There you go.
somewhat, so I will respond to a lot of situations where I obviously have to be in the presence of a trained officer to be able to do anything. But that's been a big part of my volunteering. That's been my primary volunteering since I got here. So,
How does that role complement, your medical practice and the things that you're doing in the community? But it sounds like it's just being a resource for them on a volunteer basis, just to know that there's somebody, I gotta imagine your role is like head medical person.
Yeah, lead medic, lead special response
Yeah.
team medic is my role. I think it's built my ties to the community. Honestly, it's got me patients because I see a lot of them. It helped with my main patrons at the gym or the law enforcement officers, and they're one of the main reasons I keep my fitness center going. It's been a good, enjoyable outlet for me as well. It's a time thing. So I'm not there always, but no, I think it's been good for to time into the community and to kind of help get me known. So
For sure. What you mentioned a little bit ago, you one of your 10-year or your 5-year goals was to get on a state board, right? Be a member of the state board. So there's some advocacy, right, that is important to you. Like, what motivated you to engage in like healthcare policy, and like what impact have you seen from those efforts?
similar, going back to my roots type thing. I love Mississippi. I love underserved areas. I very passionate about that. I want to increase access to care. I want to make physicians' jobs not easier, but more enjoyable. You hear burnout all the time. I want to get prior approvals and insurance companies to work with us easier. I want to expand access to care. I want to fight for physician-led teams. There's a lot of things I'm passionate about that I think are important to the healthcare of my area and state and even nationally. And doctors are busy, and oftentimes we don't get involved down there, but the insurance company's down there. Everybody else is down there. So we need to be down there. I say down there because the capital is south of me, but
Jackson,
wherever the capital is, we need to be there. And so I made that a goal of mine to get on the board, and I got on it in August. I was elected to the State Association Medical Board. So
nice, congrats. What if you were to make a 5-year goal around that? What do you think would be like the one big thing that you want to get accomplished in the next 5 years in that space?
Increasing access to care. Probably via some form of Medicaid expansion, which Mississippi has not done thus far. It can be various forms of it. I would like to see some prior approval reductions come to where it streamlines physicians and pharmacies able to get medications and procedures approved for patients. And then personally, I think I would like to look at become maybe the president of the organization within about 5 years, potentially.
Cool.
So,
yeah. Do you think that's an avenue that is, if you can become a leader in that space, that can help more of those rural communities that you're passionate about, but also help with but also help with the senior living care that you're also trying to provide? Is there an opportunity there to create policy and create change in that space to say, okay, hey, like I've already started to build something here where we're taking existing facilities and improving them and bringing costs down. Like, is there policy in place that can help, that you can integrate into that?
That's one of the things I'm looking at. My next 5 to 10 year goal is how can I take these 100 things I'm doing and kind of go up a pyramid and kind of get to where they kind of go more in line with each other. So that's something I'm actively looking at. I think there's a lot of opportunity there.
Yeah, you read my mind. That's kind of where I was going, was like, how do you've got a lot of irons in the fire at the moment. And it's like, how do you kind of mold them all together to say, okay, here's where I'm going to spend my time. And if I spend my time doing this, all of these other, it trickles down to all these other things that create a lot more lasting change.
I am super excited to introduce to you the Doctors and Dollars 5-Day Financial Challenge. I'm Mike Neubauer, I'm CEO of Grand Vision Companies, and I'm the one that you see on the Wealth Wednesday and Daily Dollar episodes with Nate. So Nate and I are partnering again to do something even more exciting, which is the 5-Day Challenge. We're taking the best of all of our episodes, all of our expertise and knowledge, and we're condensing it into an impactful and purposeful 5-day presentation, 1 hour per day, for 5 days, to give you everything you need to build that foundation for your financial future. So if you're looking to gain the pieces, you want those puzzle pieces and find out how they fit in your financial plan, head over to the Doctors and Dollars website, join us on the 5-day challenge. We're putting it together for free, so you got nothing to lose. We look forward to seeing you on the inside.
You were talking earlier about like wife, kids, all these irons in the fire. For me, support is the biggest thing. How important is having a strong support system for you in helping excel, all the things that you're trying to get accomplished and be successful in those things as you're doing them?
It's absolutely the most important thing. And my wife is with the 4 children a lot. Luckily I do get to spend, I make it a priority. I do get to spend some time with them, but I know that, the first year of my first daughter's life, I was off one weekend. And a lot of that was by my chores. I was working a bunch of extra. I was trying to build a good financial foundation for us. And we used the money I made that year to get a lot of the properties we have now. Was it the right decision? I don't know. I missed a lot more of her first year, than I did my other children. Mm-hmm. I think that, my wife's always been very supportive of whatever it is I choose. If I think that what I'm doing is the right decision, she usually supports that. And that means a lot to me, because if she was making me feel guilty about it, I would struggle with it more. And she's never once, I might be hard myself, but she's never once been like, oh, you missed the whole first year of your daughter's life. She's never once said that to me. And I struggle with that. I struggle with it, every month. Like I say, I do, for the most part, 5 to 8 o'clock every night is family time, with a rare exception.
Yep.
I try my best to make sure that occurs. But I think that having my partner, be supportive of my vision, and I do, I have cut back some. So I do usually lunch at night shift. I kind of quit that. So usually within reason, when I tell her like, hey, I think in 2 years I'm gonna work this much less. I've tried to hold up to that, and she sees that. I haven't gotten 100% to where I want to be yet, but I think she sees that I am working less weekends and nights than I used to, and I am home a little bit more, and she sees that, we are working towards this ultimate goal of being ever more present with the family. Now, and there's nothing like getting home and having your 4 and 6-year-old run up and hug you and hold you. At the same time, there's also anything like oh, Daddy walks all the time. That's also on the opposite end. That's a different feeling, But I've been at almost every soccer game. I've been at almost all the gymnastics events, ballet competitions. So I've been able to go to most of that activity. And yes, ultimately, I want to increase access to Mississippi health care. I want to help elders, but at the end of the day, I think that who's going to remember what I did is going to be my children and my grandchildren. And what I'm going to think about on my potential deathbed is probably going to be my children, grandchildren, and wife. I want to have an impact in the state level, but even if I became governor one day, which I don't want to, I'm just saying, I don't think that's what I'll be thinking about when I'm 92 years old. I think I'll be thinking about my family and closest friends. So I try to keep that at the forefront as much as possible.
Absolutely. No, that's a fantastic mindset to have. That you honestly kind of led me into the next question, because with our company, outside of Doctors and Dollars, we have Grand Vision. And within Grand Vision, we have the family office. So that's kind of our wealth management and wealth planning space that we do for doctors. But like our whole idea of doing that, and the doctors that are members of our family office are ones that have the same belief like you do, where it's just like family comes first. Medicine and making money and investing money is just the conduit to spend more time with family and build that legacy. And so, yeah, my question was going to be like, is the goal to invest in private business, invest in real estate, to give yourself more time, to work less nights, to work less weekends? Is that the conduit to get to that point? Because that is what's most important to you.
I think most of the real estate people I follow, I follow Bigger Pockets Forever, Brandon Turner, and a bunch of other ones. They all talk about buying back your time. So yes, I do. I think that also for me, growing up in the environment I grew up in, I think that that's where I struggle too. I think building a safety net, because to me, money and real estate is not necessarily just time, it's also safety. So I'm trying to figure out, how do I build up enough safety for myself and my family? And that's kind of my first step. And once I built that safety net, then I'm going to work on buying back time. So I still feel like I'm a little bit building the safety net at the moment. But very quickly, I want to get kind of a safety net where I feel like it's at a stable point. And then I want to start as much as possible buying back my time. And I think that real estate and owning a personal care home business and still being a doctor, but in a not 45-hour in a clinic a week role is ultimately what I want to do. And I have a 5, 10, 15-year goal of what that looks like. But I do want to be able to have more time at home and more time for travel and things.
Absolutely. Well, honestly, the last question that I always ask people on this show, is what's the next 5 years look like for Dr. Moffett? So let's talk through those 5-year goals that you do have. That makes it easy. You got them written down somewhere, but let's talk through those. That's a perfect answer to that question.
Yes. So increasing my administrative role in the what's called post-acute ward. So I want to increase my administrative role in nursing homes, hospice, and post-acute care to have a more I do have a somewhat official administrative role, but I want to have an increasing administrative role. I want to have an official administrative role, and I want probably about 25% of my my time spent in that administrative role. I want to reduce my clinical role by about 25% to correspond to the 25% administrative role. I want to only be in clinic about 2.5 to 3 days a week, and then the other 2.5 days be on my working from home administrative role. And then I want that to also give me more free time for my political advocacy as well. I want to be about 2.5 days in clinic. I want to be about a day to day and a half admin, and then like a day of family slash business goals throughout the week. I want to have more control of my schedule. I want to be able to pick up my kids from school or drop them off at school because my schedule allows me to do so. I want to have 3 to 4 personal care home facilities. We have one at the moment. So within 5 years, I want to have 3 to 4 of those facilities and continue to grow my personal care home business. I want to have at least 5 to 7 more rental properties within 5 years. And then I want to be president of the State Medical Association within 5 to 7 years. And then, continue working in that aspect as well. So
I love that. I always ask that question at the end because I'm a big believer in like speaking that stuff into existence, right? Like if you actually like say it out loud and you say it to someone else and you're just kind of getting it out into the world. And so, maybe you've done that before. Or maybe it's just you've only written it down and it's just you reading it. And so it's all internal thoughts, but just getting that out there and actually voicing it, you can hear it. And then it might make you switch a goal, or maybe it's like, okay, I could expand on this a little bit more to get very clear. I just always think that's a good thing. So I like to end the show in that way. So I do appreciate you taking some time out of your Wednesday, man, to sit and talk with me. You got a bright future ahead of you. You got a lot of things going on, and I have a ton of confidence just in the short time that we've known each other that you're going to be a rock star and be able to accomplish all those. So appreciate you taking some time, and I look forward to our paths crossing again in the future.
Well, thank you so much for highlighting different positions and what we're going through so that hopefully another physician or another individual can hear what we're doing and maybe it inspire them somehow or give them an idea. So I appreciate you highlighting all these topics.
Absolutely. Take care, man.